have any changes for the agenda? Yes, sir. Do we have a motion to approve the agenda? Motion. Second. All in favor? Approval of the minutes for April 13th. Motion. Second. All in favor?
I do have one public comment. Is it on yet, or is it later? Okay. I received this in the mail, and it's regarding the DSS meeting. Good morning, Kim. Thank you for keeping me up to date on all county activities. I have reviewed the Greene County DSS board report detail based on management team on April the 26th, May 11th. And as a 32-year professional firefighter, I know work ethic and professionalism when I see it. All items within the above report are truly extraordinary as we hopefully begin to exit the pandemic. Kudos to all involved. I'm very impressed and thankful for all involved within the operation of Greene County, North Carolina. The example of all involved can only be matched and never exceeded by others. I hope this thank you from just an ordinary guy makes everyone feel good and proud. Again, thanks to all, and then could you please share this under public comment as we are not able to attend. And that is Jack and Connie Gross.
All right. Wanted to do something just a little bit different this meeting, if that's all right. I sat down with my management team, which is all of the supervisors I have on the staff on the 26th of April, and just kind of went over just kind of a progress report for where each unit was and how things were looking to me as their supervisor and as their director. And these are the notes that were taken during that meeting. So just kind of wanted to go over this progress of these units. Drill down to any specifics you guys want to get into, but as far as adult protective services right now, they're a fully staffed unit, and they are conducting abuse, neglect, and exploitation assessments, and they have continued to do that throughout the pandemic with no delay in response time or anything. Guardianship and representative payee program remains stable, and those books are balancing, and people are getting what they need from those programs. Some of the changes that we've had are regarding routine monitoring visits and complaints to adult care homes. Some of those are going to be opened up a little bit to where we'll be able to go out physically more into those facilities now that folks are getting vaccinated and the numbers are dropping in those settings. So that's one of the first places in policy where things look like they're going to start easing up. Currently in that unit, we have no program improvement plan. That's what PIP means. So we're out of any kind of program improvement plan with the state there. And we've been at 100% on our MIUs, meeting those requirements ongoing throughout the year. We have lost a few payees and wards this year, some due to COVID and some due to other reasons. So took a moment to just recognize that and let staff know that we were aware of that, and gave them an opportunity to do the same thing there. And then today I got an email that the COVID orders for this unit have been extended out through August 2021 so far. So a lot of the in-person visits and things like that we don't necessarily have to do right now. They're still going out and sort of physically seeing those folks either through the window or door, or however they can get a hold of them, but they're not mandating that we do that. Child Protective Services, we've got the Surface Pro devices deployed. Checking with staff to see how they're doing with that. They are really enjoying having that flexibility and that mobility with their work. They just grab those things and go. I finally got all the components to install the last one yesterday. So it took a while to get some of those parts in, but everybody in CPS and APS access both at those devices, and they're working out great. We're working with the Real Teen Academy, which is sort of a training company that's coordinating with Western Carolina on training new social workers. They're developing sort of a whole new curriculum and a whole new way to train social workers coming into the field. And they've got some online trainings. They were working on a bunch of in-person trainings, and then during COVID, they switched it up and provided them all online. So our workers have been some of the guinea pigs to kind of be involved at the first level of that, just to kind of test those programs out and get some of that training at a free or reduced price to the county. And they've got some new trainings coming out soon. They're also working on a full simulation training, which is more than just role-playing scenarios. They work with Western to get a house, and they're setting that house up to be a mock home that a social worker might visit, and they'll have real-life actors with scripts, and so they study the policy, they study the practices, and then they go to this home and do the work, and then they break it down for them afterwards, and it gives them a lot better experience of what they might be getting ready to get into in the field, and hopefully those folks will come out a lot more prepared to go to work. None of the training that the state gives us right now really prepares us for that part of the work. They give us the policy and the why you do certain things, but as far as how, when, and where, you don't really break that down for you. So they have a simulation training coming out later this month, and they've invited us just to come and observe and just see how it goes. So we may take a day or so and go over there and just kind of watch that work and see how it goes. And then hopefully as they start doing that more and more, we can send our workers over there to get that training. NC-FAST, which is the software system and data management system that the state is using, is still being worked on. What they decided is it's going to be a separate program from the NC-FAST that the economic benefits side of the house uses. So that's going to be a really good move. It's going to just, because neither one of those things really talk to each other anyway, it's going to make the changes that happen for child welfare only stay in child welfare and won't affect the economic benefits side of the program. And the same thing the other way around. So if they change something on the Medicaid side, it's not going to affect child welfare. So that's a good move. And some of the changes they'll actually be able to make to the child protective services side of things. They might be able to actually replace full programs within that program. So I'm pretty excited about that movement. Ready to kind of see what they started on that program. This next acronym stands for the Families First Preventative Services Act. This is the new federal law that comes through the Federal Children's Bureau that's going to go into effect this year. These are some of the new federal requirements that the feds are putting on the state, and the state kicks that down to us and tells us what to do to get it here. So a lot of this will be focusing resources on preventative measures to keep children out of foster care if possible, and just going to open up some new services for prevention. Now, the challenge that I think I have, and that some of us other counties out here have, is advocating and standing up and speaking out when we see those services not being offered in our area. A lot of these service providers or mental health agencies might say that they provide a service in our area, but I may not be able to pick up the phone and get that service today. They may say, oh, we need to wait until we have a provider that can get out there and provide that service, or it might be next month before we can do it. And so just because it says it's going to be here doesn't mean it's going to be here when we need it. So I'm sort of working on a spreadsheet right now that sort of outlines what all the current services are that we have. And I'm going to reach out to all these mental health agencies to see actually how available they are and document that, so that when we start incorporating these new services, I can use that as a sort of leverage to say, look, you're saying now that this isn't available to us, but it's not. So what's going to be different going forward? So I'm kind of looking forward to getting that, making sure that that these services are provided to us when we need them. Another thing I asked was about maybe how if the counties themselves could provide these services, if we could hire our own mental health staff to provide services to our clients, and they have said that that can't happen right now. So, I'm not taking that one off the table yet, but I think it'd be much better if we did it ourselves. So we'll get to that at a later date. As far as foster care goes, we crept back up a little bit this month in our numbers, but our caseloads are still in very manageable shape. Our time frames are being met in foster care. We're getting back in court again, which is good. And specifics here, but a year-long case that our unit had been working on finally got resolved in a way that's beneficial to this child. And it was just a lot of hard work. It was a lot of doubt. There was a lot of just try involved in this case, and they kept trying, and it's paying off. So wanted to give them credit for that. Child care subsidy sat in on a Southwestern Child Care Commission board meeting. Things are going fairly well, but child care is still in a pretty perilous state right now with just how things are shaking out with employment, unemployment, and the availability of child care. So they're in a position a lot like other folks are with wage stagnation. And they're realizing that they can't bring people into work at their current wages, and that is part of what's hindering them being able to open some centers and open up more availability for child care. So being on board, we all took action to sort of help that situation last week. Hopefully we'll start seeing some improvement there. But in the meantime, if folks are out there and need child care, then they should definitely reach out the Southwest Child Care Commission or call me in the office, and I'll be sure to put them in touch with who they need to get in touch with, make sure we can get child care if they need it.
Do they have any centers open in other counties? Southwestern Canada,
They have some of them. They don't have all their centers open. I don't know the exact breakdown right now, but all of their centers are back to being open. And I think a lot of that is due to they just can't find folks to work. And if they can get a few folks in the door to work, then it will open up enough units of children to come in to cover the cost. But it's just something's got to break the ice in that equation there. So hopefully they'll get some folks hired and get some slots back open for child care.
have they not been receiving CARES Act money?
They have, and a lot of that has gone towards paying the parent fees during this time. So,
For the ones that are open.
For the ones that are open. So it's for folks on subsidy, it's paying the parent portion of the fees. Because a lot of those folks just haven't been able to work, or they're looking for work, or they're still working but not making as much. Maybe they were a waitress or something, and they're not making as much money. So
I guess I'm thinking about what was the payroll protection money.
right.
They have to apply for that.
Right. I don't know. I guess that would be open to nonprofits too. I'm not sure. But I know they got specific child care funding for that. That has floated that industry during this whole time. Folks just haven't put their kids in child care. Child support program is doing really well. Pam got a nice vacation last week, well deserved. The court has resumed for now and somewhat back to normal and stable. Pam's reviews with the state have been going really well for child support. She's gotten a couple of really nice payments back in that are going to help out the children. So there was a $10,000 payment that was made through a tax refund, and another $7,000 payment that was made. When those kind of things happen, they get mentioned statewide, and she's been mentioned a couple of times for that. So she's doing really well. They're reorganizing the representation of their state consultants. So our state rep has gained, I think, 4 more counties, but they're going to resume office visits starting in July, is what they're told me now. So changes starting to come back to normalcy in that program. nutrition, energy, and program integrity. We spent, I think, a record number on energy this year. Some of that was due to the pandemic energy that came out through the CARES and COVID funding, but we spent over $75,000 this year on energy for folks in the county. So that, you know, not only helps that many people in the county, but the vendors that we use help them out a lot too. So for over a year, they were at 100% for time limits, even during all the COVID craziness and being short-staffed from time to time. So they've done really well in this unit. I've talked with the supervisor about working with the school. I think I mentioned this last time about getting free and reduced lunches. So that I'm looking forward to that, maybe getting started out this summer when they get a little bit of a break at the school system. And also starting to look at our program integrity program to see what we can do to get some of those folks engaged and paying back the funds that they may owe through some of the fraud cases. All of our reviews have gone well with the state. I have another one tomorrow with the state folks to look at the program. They're currently not under any program improvement and are showing no real issues there. So really happy with that, being fully staffed and up and running well. Adult Medicaid, they're fully staffed again. So their folks are getting trained up and getting online really well. Currently engaged in that RETA audit. Our first month we had one eligibility error, which was enough to keep us below the 96.4% we needed to pass the month. However, the reviewers were really happy with that, with us. Apparently, I don't think anybody's passed the first month really, so it's sort of considered a learning month, and the fact that we only had one eligibility error was a good thing in their eyes. So I trust they'll be like that they do that. They've been doing that for 3 years. So we're in our second month now, and we've gotten 3 results back, and those have all been correct. So just hope that those correct cases keep rolling in. I know Connie and Tiffany are both working really hard to review all those cases that are coming in day in and day out to make sure they get picked up for review. The issue we run into in this county is we have such a low number of cases that they're essentially reviewing all of our work with a fine-tooth comb, whereas larger counties are just having a portion of their work looked at. It's for us, it's every single thing that they do is getting looked at, and it's pretty nice. So they're under a lot of pressure to do well. They're worried about it, and they're working really hard on it. We had a meeting with our, what they call the support team, the OST, and the state auditors. We went through the review, I think it was last week, and I mean, we went through all the cases they looked through this past month. We have, just to recap, we kind of separated those adult, family, and children's units into 2 units, and everybody's liking that workload being shared. Supervisors have Surface Pros, and some more laptops are coming on the way once the grant funding actually comes in. One of our workers had a baby and has come back to work, so just kind of catching up through the year of what all we've been through and what's happened in that unit. They've all been working kind of split schedules, where they're working from home 1 day per week. That gives them a chance to just kind of work in an undistracted manner and stay up on the latest of their cases. And then Kay, our newest hire, is doing great, and she is sort of on an accelerated path just because she came to us with that NC-FAST knowledge. Our family and children's Medicaid Work First program. They were fully staffed, but we're losing somebody again tomorrow, so we've got an ad out for anybody that wants to work in our Medicaid unit. So you can get an application, fill that out. We got the same info about the audit with the family and children's. They're doing really well. And then also to talk about the Medicaid transformation. And I'll just read this because I think it's important for the public to hear too, but Medicaid in general is on the brink of Medicaid transformation. So instead of the state having a contract with one entity, which was Maximus, they are privatizing the insurance and claims part of Medicaid with different contracted insurance folks will have to pick one of these plans, one of these companies that they want, or which plan is covered by their doctor, and that offers the most benefit for their health needs. People need to contact the enrollment broker in our region to discuss their options with them. If they do not do this by the 15th of this month, which is this week, the state will pick their plan for them. This means their doctor may not be covered by that plan that the state picks for them, or if they get an emergency medical transportation, it may not include the vendor that they need to get to the doctor. I'm kind of worried that not enough people have not contacted the enrollment broker or been able to contact the enrollment broker. I'm hearing that a lot of folks are trying and can't get through. I spoke with the state office about this today and let them know that we were having some issues with some of our citizens here and want them to be able to get the services that the state sends are out there. So it's important for folks, if you don't know how to get in touch with those folks, give us a call and we'll make sure you get the number to the website and everything to get your plan picked. I think when I last looked, we were still at less than 100 folks, almost 1,300 that need to sign up. So it's really important that folks sign up for those plans.
1,300 individuals.
Yes.
And I
think last time I looked, it was a little over 70. So it was 70 something late last week. So yeah, and I don't think anybody in the state's doing over 14%. So it's abysmal across the state, the number of folks that haven't signed up. So that could delay things down the road. If they have to pick insurance plans for that many people and they want to do it as thoughtfully as they say they're going to do it, just look at who that person's health provider is, and match them up with that plan to make sure they're covered. That's going to take them a hot minute to do that. And so if they've got 90% of recipients that need to be signed up, that might not be enough time that they've allotted to do that.
The recipient picks a primary care doctor or whatever. They have to go to the primary care and find out if they are associated with this particular insurance company.
If they've got a contract signed with that particular insurance company.
And what about specialists? Is that a separate? So you could potentially have a Blue Cross for your primary care and somebody else for your specialist coverage.
Could be, or hospital coverage may be different too.
I'm telling you, it's a train wreck.
With Medicaid non-emergency Medicaid transportation, it's going to be a big issue in our neck of the woods. We depend on that, and they depend on folks at Juanita's office knowing who they are and what doctor they normally go to, and where their house is. They know what it means when they say, I need to go over to Asheville to the doctor. When they call somebody in Greenville, South Carolina, they don't know from out of house cat, they're not going to be able to help them. And folks aren't going to not get help too many times before they just quit calling. And that means they're either not going to get to the doctor or have to find some other way to get there. So I know I talked with Juanita about it last week. She's pretty concerned about it. She's doing everything she can to make sure all the contracts are signed with them so they can still help, but it's got to go through this third party now to get to them. Hopefully they'll let us, worst comes to worst, let us call the providers, clarify for them or give them the information that they need to get these folks where they need to go. But I was on a call with them a few months ago and I just asked all the people there that were there from these representative agencies, asked how many had ever been out to Grant County, and I think one of them maybe been to Silva or Asheville or something. But they have no idea what have is that our administrative unit, Melissa has come back into the office. She's doing great. It says here that she deserves a Purple Heart. She was sitting in the hospital bed answering my texts because we just had no other option. But you know, she has done her duties well in circumstances where I didn't really expect her to do it. So I thank her for her hard work and dedication to the unit. We have just advertised a vacancy in that unit this week, so folks out there look for that position description. It's sort of to be the backup and be part of that administrative unit for a lot of the functions that they serve. So that ad is out there. It's for a administrative assistant. Warren, right? Get in touch with him, get an application. That's it. Anybody have any questions?
You know, we have anything else?
Not yet. I was going to get with maybe Jason and see where we could order those from and just kind of look and see what's out there. But I haven't heard any more complaints, so maybe it's resolved itself.
Do we have any conversation? Do we have any further news? Chris, if you're not going to lie, we got some more business.
Just a little bit, yes. If I could ask you to stick around just for a few minutes.
Thank you all.
Thank you, Chris. Any questions? Just holler.
You tell everybody up there we're proud of them.
I will. Yeah, I'd like to hear that. Thanks for that note from the caller today. I appreciate that. They'll appreciate that.
Take Melissa to lunch.
Yeah, thank you. Yes.
Appreciate it.
I'll check in with you.
Sure. Have some interviews in the morning. Okay, so quickly, I won't keep you too long. Everybody's aware of Billy's resignation with the community paramedics. And so we're starting interviews tomorrow to fill that position. He's in the position until May 31st. But Becky and I had talked, Scarlett and I had talked previous to that, to his resignation, about the program, and it was floundering a little, it seemed. The spreadsheets weren't getting taken care of. Started noticing just the hours not being dedicated to the program because of Billy being more on the truck helping Larry with the short staffed at EMS and him going on the truck. And that to me shows a problem with maybe where it's located and how it's being managed. Now, I'm not trying to throw anybody under the bus. I'm just trying to give you guys an understanding of why we got together and determined we feel that this program might be better suited and better managed and easier to manage. And not, again, Larry's short-staffed and emergency services is a priority. So Billy was spending a lot of time on truck and not getting as many hours as that 40-hour-a-week program needed. And we feel like it would be better served under the health department. So our intention is to conduct the interviews, and if there is a qualified candidate, choose a candidate. And by June 1st, Billy resigned. His resignation will take final effect on May 31st. We'd like to implement the community paramedicine under the health department umbrella. That individual, not necessarily the QRV, but that individual will become supervised by Beth in the health department. And it also falls more in that line of the health issues that they may have, but also that third thing that Ms. Garland had brought to my attention is the training, which is important to the elderly folks on their medication, what may be their diagnosis, and being able to communicate with their doctors. But also, as we're finding out, as we decided and we're doing our assessment of moving this program, also, some of the other areas that we've talked about and doing the same thing can also, the paramedicine, community paramedic, can also help with COVID and vaccinations, which is working and showing positive aspects. In Rockingham, I think it was Rockingham County, was where they told us that it was working. So just wanted to bring you up to date as to where we're moving with that program. And as long as there's no objections, we'd like to make that effect on June 1st. Now, there were some questions on the QRV and it needing to stay certified. We obviously want it to stay certified. And there's a way we can do that. Obviously, we want to keep it a paramedic. That person can be certified and still be under EMS and the health department. When they're doing community paramedicine, they won't be acting as a paramedic or EMS, and they won't be answering calls. However, in the event of, say, 2 trucks are out, 3rd truck is out, or a very serious emergency, with that QRV staying under the EMS umbrella, it can still be used as an emergency service. As long as we work out that MOU or MOA, that person then can become answering, as long as they keep their paramedic cert up, they can answer an emergency in the intent that it needs. So it's really, and if you look at it in that sense, it's a win-win for not only EMS, maybe longer term, and also the health department and Grant County. Although I think it'll be a little bit of an initial hurt to EMS because I think all our applicants are from the EMS department. We didn't have any outside of the EMS department or really outside of the county. So I feel it's a very important program. It can be very well used for Graham County, for our citizens. And it could also, with what the plan was initially, can help in hopefully mitigating some calls that can be handled by community paramedic. But some of these blood pressure checks, or I'm having shortness of breath, and they may not have to go out, say, with the truck every time. And so that would save in that regard. Also talking with the shortage, which I'm just finding out more about that as well within the last couple of weeks. I want to work with Larry to encourage maybe how we can maybe hold a career day or try to talk to the schools, reach out in the area and see if we can get some more people trained or make it more attractive as a good career, because it really is. And being right here in county, if you're from here and a decent living here, you're living around the school. So that's kind of where we are with the data on the paramedics program.
If you put them under the health department, then they need help on that.
They can't during their time working as paramedic, but in talking to OMES, they can, as long as they keep their certification up and they're a paramedic, and the QRV or the ambulance, and they're not working as a paramedic, they can work in that according to OMES.
And the medical director.
And the medical director.
But that's what you work to the department.
Well, that's another
That's
issue.
another hurdle.
Yeah, that we talked about with that, and they were bringing that to my attention too.
Was the other one that said that? To the department.
We just, we had an issue with,
I'm talking about the lawsuit. What was 3 employees?
Somebody in the 90s.
yeah, that was one working at the sanitation, one working at the jail. And we, because we had some issues with overtime, and it was a bad situation.
They didn't pay overtime, where today we have one working too. They get overtime if they go over 40. So that was the issue. It wasn't working in the 2 departments, it was paying the overtime.
You can't change their pay rates from one department to the next, basically, is what it was. And once they hit 40 hours, it doesn't matter where they're at, they get overtime pay. So we had to go back and calculate 2 employees, hours. One was a year and a half, and I think the other was about 6
And the intent would be, this is a 40-hour-a-week program. So it would be primary, as the grant funded, the vehicle belongs to the grant. That community paramedicine would work 40 hours a week, and it would only be sort of in emergency situations for the most part. It's not intended on being able, again, I don't know what was set up in the beginning. There might have been some confusion on that, as to why there were more hours being worked on the truck and doing the community paramedicine, but that wouldn't be the intent here. It would be the intent of emergencies and emergence that we just have to have somebody to go answer a call if they couldn't answer it. And again, that's just something that we're working out internally.
Well, your QRV will still have to be listed under the DMS program.
That's correct.
And then they would check it out, the community paramedicine, paramedic would check it out every morning, and then it would be rehoused at EMS. And that way it stays certified under EMS, it stays as a QRV. It can be outfitted based on the protocols that the medical directors approve.
Well, your issue on the QRV, if it's certified as a paramedic level, and you have a basic on there, then you may be in violation because it gives access to that basic of medication to turn on out of the house.
Yeah, it would have to be outfitted based on what their certification is.
Right.
Yeah. And so, based on who it would be hired, would be how it be outfitted and how that medical director would approve it. The other piece of it that I learned, as I was working on the opioid work group committee, was that, like in Buncombe County, they're using the CP, to help and assist with overdoses and linkage to care for those persons. And actually, their commissioner in Buncombe County said that if the ambulance gets dispatched to an overdose, then the community paramedic goes with the ambulance in their QRV to begin that intervention. So that that person, say they give them the Narcan and they come to and they don't go to the hospital, they can begin that process of working with that individual. And so that would be another linkage that the health department can provide. Plus, whenever we begin to get our opioid settlement money, that they could link up with the recovery work person, and then there would be funding that would help with not just the recovery work peer specialists, but also funding to help with the paramedic as well. So there's some value that what we learned was there's this huge component of these patients who need health education. So they're going to have that linkage with the health educator in the health department. So that these people, a lot of times they're calling the ambulance, they don't understand how to do their meds, or they're in a diabetic crisis because they don't know how to eat. And so the desire was that that linkage would occur naturally, but there's been some gaps. Of course, COVID's had a little bit to do with it, quite a bit, but there's been some gaps in between not being able to have the paramedic and the health educator really try to link up and work hand in hand. Whereas with the health department, they would be able to do that.
Yeah, I'm gonna assume you spoke to that booth already.
That's correct. And Larry as well.
I don't know, I'm kind of having some reservations on it because you're going to have two departments pulling against each other. And a lot of times when you have one department set up to run a certain thing, but then all of a sudden your individual's going to be doing something else, then you're going to have conflict between them because a lot of times the department will say it's getting to be constant and it's getting to be an issue. Sometimes it can actually create an issue, and it's kind of the same situation that it is now, is because the individual's trying to do their position and then they're pulled to fill in for other things. And that's kind of the same situation that's going
And that's exactly why we felt like this, in that instant, would make it more clear. It's sort of, it seems like there's a gray area being pulled under the same hat, whereas there would really be no conflict between the two, because this would be a person that wouldn't be in the Department of EMS. So it really wouldn't have anything to do with EMS other than an emergency situation. They would be in the health department doing community medicine. There's no pull internal to the health department, because there won't be anybody else available that could use the vehicle or do anything with that. They would answer directly to Beth. And the only connection would be the vehicle, just so we can keep it as a QRF and use it if we need it in an emergency, would be the vehicle still unhoused under EMS. And it would really just be that dynamic between the two department heads, which I would facilitate. Hey, we agree, this is a good thing, this is a good opportunity, we just need to work together on it. It really wouldn't be the pull, because whoever the candidate is that gets hired would be working for Beth in the health department. It's just the vehicle, that's the connection. Now we ask, can a person who is a paramedic certified be held into two programs in case they needed to help in a mass chasm event through EMS, and they can't. They can still be certified and being held in EMS and the health department at the same time. As a matter of fact, there are some other areas that are doing this in the way we're doing it, using it as twofold in the event of emergency and something's needed that we couldn't cover.
And I believe the state medical director, when we spoke with him, he said that in order to prevent that push-pull, you would get an MOA or a memorandum of agreement between those two departments as to what the roles are and what the responsibilities are. And I think he was working toward sending us some resources on that level, if and when we make that change.
Apparently, there's already a little conflict there. The EMS is offered help through COVID 2 different times that I know of, and we turned down. One was setting up sites to give vaccination when it first started, so you can get them all out there and be done. And the other was emergency managers called in wanting to know if we needed any help whenever they started up in the budget. And the survey that they turned that back in. And Larry had to ask the health director if she needed any help. She said not. At the same time, the county was sending registration up there. But she didn't make no effort. So apparently she don't know help from EMS already.
Well, we were notified by the state to assist the health department and to draw up a plan in your local area, how you would take and administer the COVID vaccine, which we did, and we turned it into the state, and just like Keith said, we were turned down. But the other counties surrounding was able to do so. Macon County had firefighters, EMS workers. They were doing 800 vaccines a day. Drive-through. And now Macon County is one of the highest counties vaccinated, because they pull so many resources in to be able to help. And that's one of the reasons I asked that the health department the other night, was that they plan on having an offsite. No, it's because there's other 2 facilities that's doing it. A lot of these people are not aware of these other places that can actually do it. And that's the reason I'm just having some reservations on that particular situation.
It's interesting too, because I think Dale was up there, Commissioner Wiggins was up there. I was talking to Beth the other day, and I was looking at our numbers. And when we ran the numbers from our 50, we have about, according to our residents, about 8,600 Graham County residents. And if you took a look at the 50 and above, which was what the target before they opened it up to everybody, that's about 6,000. So we we vaccinated about 3,100, and that's just the health department. So my thinking to her was, if we were around a third, if you think about it, around a third or close to 50% of that could, of course, it's not that high now because we moved to pretty much everybody or 18 and above. And I asked her, let's look at thinking outside the box. What if we set up, a lot of people won't, they won't. You can say the shot is up there at Tallulah or Eden Health Department, and they just, I've got to run up here, and they just aren't going to drive up there. Well, what if you set up, or along with the community paramedicine, or you set up a table at the Ingalls, everybody's going to go to the store. Everybody some people may go to the post office. You're going to hit a vast percentage of people right there just trying to vaccinate those that will take the vaccination. But I will say this, a lot of the people that I interact with, and I try to get out and talk to the community, there's a lot of that conspiracy theory census out there. It's just like, they haven't studied it enough. I don't hear as much about being injected with a tracker or something like that. It's more, yeah, it's more of people not trusting the vaccine itself. So I say that to say I would still like to work with Beth to see if we can't get our numbers up. However we decide to do that, there's ways we can try to approach this to try to keep getting our numbers, keep trying to get our county residents as close as we can to as many as possible vaccinated. So I will continue to work with that. And I certainly understand the reservation. I'm concerned with it's in the position as it's in now. It's really floundering, and it's the program's being neglected, and it's the way it could probably potentially help not only EMS but the county, the residents of Grant County.
Well, I feel it's more of the one that's hired to do the program than it is for his act.
Could be. You could be 100% right. You're absolutely correct. It could be that.
I think at the very beginning, he started off like a ball of fire, and then it run off in what?
I think one thing we don't need to lose focus on, and that is that we're trying to provide what we believe is the most needed service to people that need that service. We already know that our ambulances are being, or have been used basically as emergency rooms or some version of almost primary care. I understand Lynn's concerns and Keith's too. I think sometimes you have those things that cause friction, and sometimes there's a resource, sometimes there's not. But we can't lose sight of the fact that this is a service that we want to provide, or at least I think we do want to provide. And if it will operate better at the health department, then so be it. We won't know until we try. We do know that it's floundering right now. I don't know that the EMS director wants to keep it. I've talked to him directly, so I don't know what his feelings are on that. But, you know, it makes sense in a lot of ways to get the health department because of the, you know, there'll be nurses there that can advise, there's health educator that can help with some of the issues that may come up. And especially people needing help with medication and different things. So I don't understand all this stuff about the CRV or ORV, whatever it is. I'm assuming that's that car, right?
Yeah.
And I get what you're talking about, and it has to be basically set up to where the medical director says it's okay. We need to make sure that we follow all those rules. And, you know, hopefully we can get a paramedic or someone qualified, well qualified to do the job.
We did, Ms. Booth did speak to Dr. Winslow, who's her medical director, and they're all excited about that opportunity. And I'll say, all valid points, and the only thing I would say is my fear is because EMS seems to be consistently having issues with keeping people, and I understand why. We can't pay, but you can't really compare Graham County EMS with Cherokee County EMS. Or tribal.
Graham County, it's every county's having the same issue regardless of the pay.
Regardless.
It's the band of Cherokee.
Exactly.
They may be better off than the counties on as far as being able to attract personnel, but, you know, the reality is there aren't people out there getting trained, and, you know, then, have they started that 2 or 3 thing yet for paramedics?
It's already in place.
So you gotta get an associate's degree to get up to paramedic level. And, you know, if you can figure out a way to recruit and try to get people interested in it, go for it. Because it's, you know, 10 years from now, we're gonna be, if we're having trouble now.
We ain't going 10 years, not 2 to 3.
Yeah.
Well, you know,
We got about 3 or 4 of them in the town.
Yeah. Yeah.
the CDBG grant that we got is for training new paramedics. And so, one thing, we got an onboarding call with that grant, we finally got this commerce to find our paperwork. But it's about $45,000 that can go toward paying their scholarships and making scholarships to these students. And so, you know, as Mr. Marino was saying, you know, we've really got to double down on working with Tri-County, or if Tri-County can't do it, Southwestern, to help these high schoolers at least start working toward that attainment.
Well, we used to do it in-house, and I know things have changed, but, you know, whatever equipment was necessary, I don't know what's necessary in one of the classes, but, you know, we have to set up our own thing somehow with.
Well, actually, the county has its own teaching credentials. You can actually teach up to the advanced EMT that the paramedic has to go through to be doctors. The basic, a lot of schools are already teaching the basic in schools, just to, but the interest is it's not there.
The interest.
That's the biggest thing.
I'm wondering if we could work together with our EMS and our paramedics and have some sort of a career day. Go down to the school and do a presentation. And maybe try to catch that interest. Get people, show them what it's all about. I don't know that they know a lot. I mean, I don't know. I'm trying to look into this.
Well, just from experience, you can have 20-some people sign up for a class. And the time the class is over with, you may have 4 or 5.
I was like 30.
And
That's what you.
But and at the end of the day, 3 would be great. 3 would be great if we could get 3 people join on our EMS squad. And that falls back to my concern if, and again, our 3 applicants are from our EMS team. When we choose one of those and it stays under that, it could potentially do the same thing that's happening now. They're gonna need somebody to take an injured paramedic shift. And again, it's not getting covered. Whereas if it moves, obviously, if we hire one of these applicants and they're qualified, they leave the EMS part. And I know that's gonna leave them short of a can again. But I think it helps in the long run. Because if we look at it from, if this gets to be operated as it's supposed to, we feel it will limit some of those, I don't really know the best word to use. We limit some of those calls where somebody's just a little bit afraid. They need to be checked out. So that's the kind of the way we're looking.
Because I teach in the community college. I teach all the way to Boone, Isopone, Blue Ridge, I mean everywhere. And you can see the numbers dropping. They're going down and down. You just don't see people like this. I mean, at one time, we done state exam, there was 300 people that taking the state exam. Now, you may have 20 or 25.
That's incredible. I mean,
The
do we
state
think
exam is given 4 times a year throughout the western part of the state. And, a lot of times the average was right at 30. And now, you can't, now we've got, providers out there just want to give them a test thing. So, that's one reason is, it's just the interest is going down. At one of the classes at AD Tech, we had, a little over 100 EMTs. We only had 5 paramedics. And none of the EMTs were too interested in working.
that's wild? I wonder why. I mean, obviously, maybe it's the pay. I mean, I don't know. They've lost interest.
I hate to say the generation now is not willing to open a book up.
It's not a video game.
That's right.
They're fun.
It's that big and they don't want to read it.
That's exactly right. Well, you got a book that big, and then you've got 2 others that goes with it, and they just look at it and go, I don't know what that means. Yeah, and then when they get back to them, let's say, they're looking for something to push, instead of learning how to do it their own.
That's right. That's right. Well, that's all I wanted to bring up as far as just kind of give you an update of what we're looking at.
All right. Anything else? We have a motion to adjourn. Thank you. All about. Nobody on
He had a ball game. Well, I had a ball game. He forgot to tell me this morning. He's the coach. Is that all?